Hello, thanks again for coming to Cancer Logic. My name is Dr. Karn Log, and I'm a cancer specialist practicing in Colorado. And today I'll actually talk about when enough is enough and when we should actually consider potentially stopping any type of treatment for someone's terminal illness. And so this week it actually started off with a conversation I had with a patient I've had for a while, diagnosed with stage 4 cancer. And I've had this conversation with this gentleman for many visits that he's had, but his family happened to be in town, and I actually talked more about their family, and they had additional questions, and I was more than happy to talk to them about his current scenario. But one of the questions that came up was, well, given his stage 4 disease, when is enough enough? And so the difficulty that we talk about when we talk about stage 4 cancer or metastatic cancer that has spread from one organ to the other is we generally consider the disease to be non-curable at that time. So when we talk about treatments, the purpose of treatment at this time is no longer to provide cure. The purpose of treatment is to prolong life. But what we inevitably see is that cancer will still, unfortunately, get to a point where the treatments are no longer effective, and we do unfortunately expect most patients to then succumb to their disease. And so, that question came up with, okay, well, when do we continue and when do we stop? And so an important thing to consider is there's always two factors to look at. One is the personal factor. And patients are never obligated to continue or even pursue any type of therapy. One perspective that I always have is that when we look at disease, unfortunately, disease is very, very natural. And so when we talk about cancer, cancer itself, is a natural process. And so if someone were to be diagnosed with a stage 4 cancer, they could actually at that time make that decision to personally not pursue any further therapies. And even if they look at pursuing therapies, no patient is ever obligated to continue therapy. So when we talk about stopping therapy, the first thing is it could just be a personal decision where a patient can just look at all factors, whether it's side effects, whether it's logistics, whether it's time, whether it's unfortunately finances as well, to make a decision to stop and not pursue any therapy. The other part of it is also, well, when is it medically non-beneficial to continue therapy? So one of the things we always have to acknowledge with any treatment that's medical is that there's always going to be side effects and toxicities associated with that. And so there's actually a scale that we use in cancer that was developed by the Eastern Cooperative Oncology Group, or abbreviated ECOG, ECOG. And ECOG created a scale called performance status that really helps us determine whether or not patients would benefit from treatment. And so the performance status scale goes from 0 to 5. And so basically patients with an ECOG performance status of 0 means that they've been diagnosed with cancer, but as an external observer, you wouldn't even know that they had cancer themselves. They're cooking, they're cleaning, they're taking care of themselves, they're working. And again, an external observer would not know that they even had cancer. When you have an ECOG performance status of 1, it means that now you are developing some type of symptoms of your disease. So you may not be able to work full-time, but you can carry on light duties. You can cook, clean, do the laundry, mow the lawn, things like that. Once you develop a performance status of 2, it means that you have more manifestations of your disease and are simply just getting weaker. So what we look at is that if patients are able to be ambulatory, they're up, they're walking, and they're out of bed or out of a chair more than 50% of the day, then they would have a performance status of 2. Patients then move to a performance status of 3, where they have severe symptoms of their disease, and they are in bed or in a chair more than 50% of the day. A patient would have a performance status of 4 if you are in bed or in a chair basically all day. A performance status of 5 is unfortunately someone who is actively dying. So what we know is that the better the performance status, the better individuals are actually able to tolerate therapy. So it's not that we're looking at someone's age, where we've seen it before, like, hey, the patient's 90, they're not going to, benefit from chemotherapy. again, we don't look at age, because you look at comorbidities, but we also really look at this ECOG performance status. So what we know is that in patients who have an ECOG performance status of 2 or less, so again, 0, 1, or 2, that they do have the potential to benefit from chemotherapy. But again, the better your performance status, the more likely you are to benefit from chemotherapy. Once patients have a performance status of 3 or worse, which means that, again, you are in bed or in a chair and non-ambulatory for more than 50% of the day, this is where it gets a little dicey, because it means that the likelihood of treatment and chemotherapy, there's a higher likelihood that they will be hurt by the treatment than benefit from it. So from a medical standpoint, we look at performance status. And so if somebody generally has a performance status of 3 or worse, again, you're in bed or in a chair more than 50% of the day, then at that point we would then recommend that there are no really good treatment options to present to those patients at that time, because again, treatment would more likely hurt them than help them. And so, but that's always something to take into consideration, and speak to your doctors about different treatment options that you may have as well. Again, hopefully you found that helpful in terms of, treatment decisions for yourself and for your family members or loved ones. Again, if you have any questions, feel free to comment, feel free to like. Again, feel free to share with any family members that you feel like this could be helpful to. Again, you can always reach me on Facebook, and you can email me at cancerlogic@gmail.com. If you have any questions, I'd love to have any feedback and appreciate your time. Thank you very much, and thanks again. Bye-bye.